Behind me is a list of 300 plus hospitals that are projected to close if the big, beautiful budget bill goes through. Hey guys, so I keep getting these idiotic comments from Maga saying that hospitals aren't going to close.
310,000 Pennsylvanians are going to be kicked off of Medicaid. 140,000 Pennsylvanians are about to lose their SNAP benefit.
This is what's coming to you in them red states, whether you like it or not. 1 out of every 4 rural hospitals will be shut down. A lot of people work at these hospitals. They ain't got no jobs no more.
Well, Trump just stopped all of the J-1 visas for the over 6,000 medical residents who are supposed to be starting in the United States this July 1st.
I had a sneaking suspicion once that list was released of which hospitals are going to be at risk with the big beautiful bill. Of course ours is. We only have 2 major
Rural America is facing a full-blown maternity care crisis and no one's coming to help.
Behind me is a list of 300 plus hospitals that are projected to close if the big, beautiful budget bill goes through. I am going to give you the facts right now. So each of these hospitals on this list ended up there for 2 reasons. 1, they are in the top 10% of Medicaid receivers in the entire country. Or B, they reported a loss over the past 3 years. Now, you might think this does not affect you. Who's on Medicaid? I'm not on Medicaid. You might not be on Medicaid. But 82 million Americans are. And who does that cover? It covers children. 4 out of 10 children are on Medicaid. People with disabilities, everybody knows somebody with disabilities. Low-income adults, and elderly in long-term care. Now, I've given you all the shitty facts and you're like, okay, great, now what? Now you need to call your representatives, your senators. I know everyone says that, but this is how action happens. When phones are ringing off the hook, it gets noticed. Call after hours, leave voicemails, send emails, share this with everyone that you know who could possibly be affected by this or who cares about people who are going to be affected by this. While you might not be affected, I might not be affected, our most vulnerable neighbors will be affected. And if we claim to care about all Americans, our legislation and our budget needs to reflect that. I know we all saw Mitch McConnell's comments today about a lot of senators getting phone calls from back home about the cuts to Medicaid, but failure is not an option and they will get over it. That's what he thinks about his constituents. If you're fine with that, be fine with that. But I'm not okay with that.
Honestly, it is really getting... I don't even know what to say first. Hi guys, welcome back again to my YouTube channel. It's Sonia and I'm back again with another mind-blowing video. If it has gotten to the point of hospitals shutting down, I wonder the points that we're actually going to be heading into. Honestly, when I was going through the Wall Street Journal news and when I saw it, I was like, don't tell me rural hospitals shutting down massively, like massively in the US. Guys, I have other clips, I have other videos that I'm going to actually show you guys so that you guys can actually see what other people are actually saying, what is people's opinion, how people are really faring, how the state is actually driving some people to not as it stands now. And I just want to get your opinion in the comment section. You guys know that one place we really do communicate with ourselves is the comment section, because my God, hospitals is one of the things I feel like we need. Anyways, let me not talk too much. Let me play the videos for you guys, some of the clips I have, so that we are going to get into our conclusions.
Hey guys, so I keep getting these idiotic comments from Maga saying that hospitals aren't going to close, but that's ridiculous. We know they are. We're getting reports out of multiple states saying that several hospitals and healthcare facilities, clinics are closing. But there are some businesses, some agencies that actually do financial analysis for healthcare facilities across America. And so I'm just getting ready to read to you some of these pending closures for various states. And of course, we know the red states are going to get hit the hardest. They really are getting fucked. So first up, Alabama. Man, you guys are really getting it. 28 hospitals at risk of closing. 23 of those are at immediate risk of closing in the next 2 years. Let's see here. We got Arkansas. 30 are at risk of closing. 11 that are at immediate risk of closing in the next 2 years. Georgia, man, you guys are also getting screwed. 20 hospitals at risk of closing, 9 at immediate risk of closing in the next 2 years. I wonder where all of those people are going to go, and where are the employees going to go, and what is that going to do to your economy? Like, this bill decimates the healthcare industry, and I don't want to hear anybody else saying shit about how it's not. Shut up. Illinois, I know you're a blue state, but you're also getting fucked. 17 hospitals at risk of closing, 9 at immediate risk of closing in the next 2 years. Oh my God, Kansas, whew, I gotta take a breath, y'all, because this shit is wild. Kansas, 66 hospitals at risk of closing, 29 of them in the next 2 years, immediately. Kentucky, you're getting fucked. 4 of them are going to close immediately. 16 are at risk of closing. Louisiana's getting fucked. 25 hospitals at risk of closing. 7 in the next 2 years. Let's go down here to Mississippi, because, man, Mississippi is getting it. 36 hospitals at risk of closing. 20 in the next 2 years. Montana's getting it. Nebraska, we already know you're getting it. We've heard that already. New York, man, I'm sorry for y'all, because you guys tend to vote the right way. New York has 29 hospitals at risk of closing, 18 at immediate risk of closing in the next 2 years. Let's take a look at Oklahoma, because Oklahoma's really getting fucked. You guys, 47 hospitals at risk of closing, 23 at immediate risk of closing in the next 2 years. Pennsylvania have 9 up for immediate closure in the next 2 years. Oh boy. Texas. You guys fucked the rest of us, and now you getting ready to understand what getting fucked feels like, because 87 hospitals are at risk of closing, okay? And that's like almost a 60% risk of closing. 22 in the next 2 years. Talk about fuck around and find out. Y'all really getting ready to find out. There is a whole list on here of each state. There's only a couple that are immune from this, and I think it's like Utah and New Jersey. So we really got fucked. Maga and Trump and his billionaire buddies have fucked the working class and the middle class. And it was also they could give these billionaires a tax break, so their income goes up. And there are a lot of MAGA who are going to suffer from this shit, but they're too stupid to realize it. So, anywho, 2026, the midterm elections are right around the corner. You better get out there and vote like your life depends on it, because it really does. I'm going to put the link to this in the post so you guys can see exactly what I'm talking about. Have a good day, y'all.
This is what's coming to you in them red states, whether you like it or not. 1 out of every 4 rural hospitals will be shut down. A lot of people work at these hospitals. They ain't got no jobs no more. Not to mention them shutting down also nursing homes. If you got people in a nursing home, guess what? He gonna be in the garage soon or in bed with you or somewhere, because they're gonna be shutting down nursing homes all over there.
J.D. Vance says you just need, families need to come together and shoulder some of this.
You need to, yeah.
You need child care, get grandma.
Sure.
You need grandma care, just get the kids.
You ain't got no child care. Grandma may be a little, needs to be in a special place, where they're going to shut down that special place so you can bring home Alzheimer's to look after your kids while you at work.
Can you just think about what they're doing to grandma's special place? Think about it.
I don't want to think about it.
Oh my God, when he said I don't want to think about it, honestly, my heart just dropped, to be honest. A lot is really going on right now. And it's really hitting hard, because how do we just start coping without a health care? Like, that's a question I keep asking myself. Anyways, let me allow you guys enjoy the rest of this clip. My God.
Well, Trump just stopped all of the J1 visas for the over 6,000 medical residents who are supposed to be starting in the United States this July 1st. So let's talk about the absolute craziness that is about to ensue. So while we were sleeping, nearly 7,000 J1 visas for doctors who are starting July 1st were paused. Residents were supposed to be getting these in June. Here's a message from the Foreign Medical Graduate Commission saying that everyone should be on pause. And here's the over 6,000 medical professionals who are supposed to be starting. If the administration does not pause this immediately, we are going to have absolutely huge effects on healthcare, and you, the patient, are going to be paying the price. Tag your senator, tag your favorite doctor.
310,000 Pennsylvanians are going to be kicked off of Medicaid. 140,000 Pennsylvanians are about to lose their SNAP benefits, that's the food assistance benefits. And we have about 25 rural hospitals that are both working with an operating deficit, where about 50% or more of their revenues are coming from public payer, right? Coming from Medicaid. And so if you're already facing a deficit and your Medicaid is being slashed, we estimate that there's about 25 rural hospitals that are likely to shutter in the next few years because of this. So I want you to know what they voted for, okay? They voted to give a tax cut to those at the highest income brackets who frankly don't need it, and to pay for it by slashing Medicaid and SNAP and harming rural hospitals. This isn't politics. This isn't hyperbole. They knew what they were voting for. They voted for it. It's now law in Pennsylvania. As to the second part of your question, let me be very clear. Pennsylvania can't backfill this. We don't have the money to do it. I warned these members of Congress that we couldn't do it. And so the cuts that are about to come are coming as a direct result of how your federal representatives voted here. We can't fix this for them.
I had a sneaking suspicion once that list was released of which hospitals are going to be at risk with the big beautiful bill. Of course ours is. We only have 2 major hospitals, and when I say major, they are not major because usually they have to send people all the way to UC Davis, which is a good 4-hour drive from here, to even get medical care. So, so now that we're going to possibly be getting shut down of our hospitals, like 911 better be good, because guess what? The nearest hospitals are either 45 minutes north into Oregon or 45 minutes south into California. If there's any negative weather happening, you better hope 911's making it to you, or else you're going to die, friend. Sorry.
Rural America is facing a full-blown maternity care crisis, and no one's coming to help. More than half of all rural hospitals in the United States have no labor and delivery services. And the ones that do, nearly 200 of them are at risk of shutting down maternity care entirely. These hospitals aren't cutting services because they want to. They're doing it because they're losing money every single time someone gives birth. So here's the financial reality. Medicaid pays for over 40% of births in rural areas, but it reimburses less than what it costs to provide that care. So that means hospitals lose thousands per delivery. In fact, even if a rural hospital has a fully staffed maternity unit, it can still lose money just by keeping it open. So this isn't just bad business, it's a public health disaster. When rural hospitals close their OB units, families are forced to drive over an hour to the nearest delivery center. That's dangerous. Maternal and infant mortality increases, preterm births increase, C-section rates go up, and rural Black and Indigenous women, they face the highest risk of death and complications. So even when hospitals try to keep their services open, they can't recruit and retain OBs, midwives, or even anesthesiologists because the pay doesn't match the risk and the funding simply just isn't there. So this isn't truly a workforce problem, it's a payment problem. There's no current federal payment system that guarantees maternity services will be sustainable in rural hospitals. That's the issue. And this isn't just anecdotal, right? So all this data is from the 2024 report by the Center for Health Quality and Payment Reform, which is called No Cuts, No Care, The Crisis in Rural Maternity Care. Here is the truth. No OB means no deliveries. No deliveries mean no care. And no care means more deaths. If we don't reform how rural maternity care is paid for, especially through Medicaid, we're going to keep watching hospitals cut services until there's nothing left to cut. So this isn't just a crisis, it's an absolute policy failure. And we have to say it louder. No cuts, no care.
Guys, let me know what you guys think in the comment section, because as at this point, to be honest, it is actually not funny, because a lot of things is going to be happening. Just imagine yourself with a street without any hospital. Let's just put it like a street without any hospital. That is what you should imagine right now, a street without hospital. Talk more of a lot of rural hospitals closing down. It simply means that for you to get medical care services, you have to move to another city, or you have to move to another location, and of which it's not funny, because just imagine if there is an emergency and there is no any healthcare center in your environment. I think, Donald, you need to do better, honestly. You need to do better, and we just pray that every single thing that has really been going on should just slide down, because we are feeling it hot here as well. We are feeling it hot, not minding the fact that we are not staying in America, right? You guys know that anything affecting American affects a lot of countries, and I'm not going to say the hate is not getting to our side. The hate is also getting because our people are also being deported. Our people also need medical care centers that are also there. So this is not really just for you people alone that is living in the US. This is also including those of us that are not even staying in the US, because we are also getting it economically, physically, and every other stuff. Rural hospital shutting down is no longer a news. Let me know what you think in the comment section. What is your opinion? What do you think should be the next thing that should be done? Despite the fact that we know that a lot of us, we know that our opinions, like, it doesn't matter. It is just those ones in power that their opinion matters, right? But let's just discuss in the comment section. Anyways, if you have not subscribed, like this video, drop me your comments, and lastly, do not forget to share for every other person to get this good news. And yes, with no further ado, I do like I say in my videos, I'm going to be saying, and I'll see you guys in my next one. For now, bye. I love you guys. Mwah.